Merci, Marc. Bonjour tout le monde. Hi, everyone. Thank you for joining us for this special occasion. On behalf of Johnson & Johnson MedTech, I'm thrilled to be here today to recognize outstanding talent within Canada's Master of Health Administration program. Ces étudiants, choisis par le corps professoral de leur établissement respectif, incarnent le mieux les compétences, les connaissances et l'attitude nécessaires pour exercer le leadership en gestion des services de santé au Canada. They are the future leaders of our healthcare system, and we are proud to support them with the Robert Wood Johnson Awards. In this milestone year, the 70th anniversary of the Robert Wood Johnson Awards, J&J MedTech and CCHL are especially pleased to welcome a 7th university to our program, the University of Regina. We are honored to recognize the inaugural recipient from the University of Regina as part of today's celebration. Woo! As we all know, the theme of this year's conference is courage. This past year has been one of rapid changes and significant challenges for our health system. All of the reforms, demographic shifts, workforce shortages, continued long wait times for medical treatments, combined with mounting financial pressures, have stretched us thin and at times pulled us apart. Yet, precisely because these challenges are so great, unity and collaboration matter now more than ever. Nous entendons tous un appel de besoin pour le changement, mais sommes-nous prêts à l'entendre individuellement et collectivement? Sommes-nous prêts à se regarder dans le miroir et faire les changements nécessaires pour nos enfants? Can we find ways to do more with less, to work differently, and to innovate and bring value to our society? Do we have the courage to name the hard truths, speak up when improvements are needed, and to support one another when the right choice is also the difficult choice? Can we create an environment where I don't know is met with curiosity and compassion, and where we are humble enough to let someone else lead? And I'll add something that Mike Downey shared this morning. Can we prepare, have interest, and also give empathy when it's needed? Courageous leadership is required at every level and across all of our organizations, both public and private. To our awardees, whose rigor, dedication, and scholarship we celebrate today, I ask each and every one of you, can you please bring the same courage and dedication to the work to our broader community? We need it. And to every single other person here, I ask, let us find a way to include them and give them a place at the table and also a voice by listening to what they have to say. And this can all help build our collective future better together. Notre système de santé a besoin de nos efforts collectifs et le courage de chacun d'entre nous. Et ces lauréats ont démontré avec audace que quand on veut, on peut. These leaders have demonstrated that where there is a will, there is a way. And that is courage in itself. Thanks. And our first honoree today, I'm so proud that this inaugural recipient from the University of Regina, the new member to our program, is Joshua Proffitt. Is the slide appearing? Is the slide appearing of Joshua Proffitt? Perfect, excellent. So let me just present you before I'm going to give you a little moment. So a healthcare leader with experience across acute care, community emergency services, and inpatient operations, Joshua Proffitt is recognized for his steady, patient-centered leadership. A registered nurse by training, he began his career in surgical services before moving into management roles that strengthened clinical operations and team performance. Now completing his Master's of Health Administration at the University of Regina, Josh serves as Health Service Director, Inpatient Medicine. His leadership during the COVID-19 pandemic, wasn't so long ago, earned him the Queen Elizabeth II Platinum Jubilee Medal. Please join me in congratulating Joshua.
Thank you. Receiving the Robert Wood Johnson Award is an incredible honor, and one that I accept with deep gratitude and humility. I'd like to thank the Canadian College of Health Leaders and the faculty at the University of Regina for the recognition. To be selected as the inaugural recipient of this award from the University of Regina means a great deal to me. Knowing that they see the potential in me to make a meaningful difference in healthcare and for the people of Nova Scotia is truly special. This journey has not been mine alone. Completing my MHA while raising 3 young children has been one of the most challenging and rewarding experiences of my life. None of it would have been possible without my wife, whose unwavering support, patience, and belief in me carried me through it all, even through the most demanding moments. I'd also like to take a moment to honor my mentor, Kitty Connell. For those from Nova Scotia Health know Kitty well. Kitty passed away unexpectedly in 2023, just a few months short of her retirement. But her impact on my career continues every day. She inspired me to begin the program and believed in my abilities as a leader long before I believed in myself. This award is not a finish line. It reinforces the responsibility that I have to lead with purpose, courage, compassion, and integrity, especially in a time when our healthcare system faces real and complex challenges. It reminds me that leadership in healthcare is not just about systems and strategies, but it's about people, patients, families, and communities that rely on us to do better. I'm committed not only to applying what I've learned, but to continue to listen, to grow, and to challenge the status quo where it falls short. I will carry forward the belief that meaningful change is possible and that thoughtful, values-driven leadership can help build a stronger, more equitable healthcare system for all. Thank you. Thank you.